After leaving JABSOM, I went to Stanford for my pediatrics residency. And while I was there, I had an amazing time, and I also had the opportunity to do a lot of public health and advocacy work, including in the area of human trafficking and healthcare. Then I decided I was very passionate about public health and decided to take a bit of a career change and went over to the Harvard School of Public Health, where I studied U.S. health policy and became very passionate about protecting the Affordable Care Act and all the gains that would help to address health disparities. I had a mentor who suggested that I should head to Washington, D.C. and try to use my new policy skills. So I did, and I did a fellowship in general academic pediatrics at Children's National Health Center there in D.C., also in partnership with the George Washington University and Johns Hopkins. And I did a lot of research on health policy, was able to publish a bit on health policy, and then heard about the opening in Senator Schatz's office to manage his health policy portfolio. There's been many wonderful moments. One is telehealth, where it's really exciting. The senator was really passionate about how do we use telemedicine and how do we expand it in Hawaii and the nation. I was able to dive in and be the lead congressional staffer on our bill, the Connect for Health Act, which would lift a lot of existing restrictions on Medicare reimbursement of telehealth. That's been a wonderful experience. I would also add the appropriations process. Being in touch with a lot of folks from JABSOM through the appropriations process to see what are our priorities in the state, how can we help to fund them, especially from Senator Schatz's role on the Appropriations Committee, has been really meaningful, especially when we get those bills back that actually see real dollars flowing to our state. Being able to take what I've learned not only right here in our JABSOM building, but also through my experiences, whether it was at the Waianae Coast Comprehensive Health Center, at Kapiolani, in Kalaupapa, in the Marshall Islands, learning about social justice in our social justice interest group or our global health interest group. Being able to weave all those threads together into policy has been really helpful to try to support, again, all the initiatives that are really homegrown from Hawaii and to try to really amplify our diversity and our strengths here and to show that on the national level. I think it's absolutely critical. It's really wonderful to be excellent at clinical medicine, and we do have to prioritize that. But we also recognize, especially through all that's been going on in terms of understanding social determinants of health, that there are so many different aspects to people's health. I think about often when I try to take care of patients with asthma, and you can try to address that asthma as well as you can from a clinical perspective, but at the end of the day, you can't fix the mold in the home. You can try to call in the medical-legal partnership, but if it's a public housing complex that has been there for a while, there's not a lot you can do. If there's, multi-generational poverty, that's also difficult to address from the pediatrician's office, for me in my pediatrics background. If there are schooling issues, that's also hard to address from the doctor's office. So there are just so many different angles to health that if we really want to get at some of those most underlying issues in health, we have to go beyond the clinic. But JABSOM, I think, does a wonderful job in really showing us how we can do that. Working with Dr. Jill Amori and the Home Project and Dr. Seiji Yamada with a lot of our social justice initiatives has really been inspiring and has really helped to lead the way in terms of getting involved in advocacy and policy. And I just really look forward to using my skills and background and now policy experience to really the good of Hawaii and the nation. Yeah, it's an honor to be here and an honor to be profiled here.